Well, March is Colon Cancer Awareness Month. Early screening is key in detection and treatment. This disease has no boundaries as it is showing up in younger patients.
Here with more insight, today's CI Health sponsor, Carle Foundation Hospital. We have Dr. Robert Yu, Associate Medical Director for Colorectal Surgery and Digestive Health Institute, joining us. We appreciate you being here, and so we can learn a little bit more about Colon Cancer Awareness Month. It sounds like it's the third most, popular, I don't want to say popular, but most common cancer. So what are some of the risk factors that we need to be mindful of?
Sure. When I talk to patients about this, it's really thinking about those factors, and I kind of think about it in two different groups. And so the first group is things that you have control over. And so when I think about those essentially are your diet. So a diet that's high in fat, high in red meats or processed foods can really have an increased risk of colon cancer. In addition, obesity can do that. And then finally, when you think about that, excessive tobacco and alcohol consumption can also lead to those increased risks. However, there are other groups too that you don't really have control over. And when we think about that, those are the genetic diseases that we actually get, and we don't have any control because we inherit them from families. Also, there is chronic inflammatory conditions like ulcerative colitis, Crohn's disease that we all have. And finally, increasing age is also a risk factor.
Are there certain things that people should look out for, or if they're noticing changes in their body, that this might be pointing towards something as serious as colon cancer?
Yeah, absolutely. So when we think about colon cancer, they actually have quite a few symptoms. And so when we think about them, we often notice sometimes people having abdominal pain or discomfort. Sometimes they have changes in the way that they go to the bathroom or stool. So they either have a narrower than normal stool. Sometimes they notice some blood in their stool. Sometimes it's even just as normal as weakness or fatigue or anemia. And actually the scary and more frightening part is sometimes it becomes totally asymptomatic. You don't have any symptoms at all until it becomes really, really advanced.
Well, and then that's where some screenings come in, and we'll get to that here in just a moment. However, you just mentioned an increase in age could be a factor, but we are seeing an increase in patients who are trending a little younger getting colon cancer. What do you think that's from?
Yeah, so it's typically been thought of as a disease of older adults. However, recently newer studies have shown that, and there's actually been a double and increase of the risks of finding and diagnosing colon cancer in between ages of 21 to 49. And so we don't really know the true reason for that yet, but we speculate that it's probably related to all those risk factors we talked about. So the increase in obesity, unhealthy lifestyle decisions can really put essentially be thought of as the reason for it.
So let's talk screening. When should people get screened? How often? And what's that process look like?
Yeah, so there are definitely different screening options that you can do. And so the two screening options that are available are either stool-based tests, which are tests that you essentially send the stool sample to the laboratory. And there's also visual examinations. And so a colonoscopy, for example. And there are now recommendations for that. And so we used to think starting at age 50 is when you should get screened. But because of the increasing incidence finding in younger people, our societies have now said we should do it a little bit earlier, which is now at age 45. And so the other main best test for that is something called a colonoscopy. And basically it's a procedure where we look into the colon and we insert a instrument called a colonoscope, which is a big tube that has a camera at the end. And so we're able to visually inspect the colon inside, and we look for abnormalities such as a polyp or growths, and we take samples of that or remove it altogether.
Yeah, we were looking here at some of the things that happen during the colonoscopy. What do you think it is, though, that makes people, I guess, hesitant about a colonoscopy or going to the doctor when they are noticing some of these symptoms? Because, I mean, it's not something that you really want to, I guess, talk about or think about. It's just like, oh, I don't want to go there.
Yeah, it's an interesting process just because any medical procedure can be anxiety-provoking for anyone, and colonoscopy is certainly no exception to that. I think the hardest part about the colonoscopy is really the day before, because we have to prepare your bowels in order for us to be able to see the inside to look for those abnormalities that I talked about. And so how we do that is we really give them some preparation by giving them medications, so laxatives, to really flush out the bowels the day before, and we ask them to fast at the same time. The next day, day, we ask them to come to the procedure area. And during that time, we give them medications like sedatives and pain medications to really keep them comfortable and to minimize any type of discomfort that they may have during the procedure. And then after that, you get to go home. The procedure in itself takes about 30 minutes, and then you get to essentially be almost feeling back to normal by later that evening or most likely the next day.
Yeah, so maybe take that day off before and
little self-care time.
Yes, exactly. But if the end result is knowing that you are cancer-free or that you've caught it early enough, then that's probably the goal right there.
Yeah, absolutely.
Okay, well, great tips here as we are learning a little bit more about Colon Cancer Awareness Month this month. And we will connect you at CILiving.tv with all of that information. And we do thank Carle Foundation Hospital for sponsoring our segment today.